It's becoming more and more common for people to work past age 65, even past age 70. So what does that mean for your employer's group health plan and its relationship with Medicare? In today's video, we're going to look at what implications working past age 65 has on your involvement with Medicare. Here's what we're going to cover. Let me share my screen with you. First, we're going to go through, do you need to enroll in Medicare? Secondly, we'll be addressing what happens if you don't enroll. And thirdly, if I need to enroll, how do I enroll and when would I do that? Whether I do it now or whether I do it later. Well, my name is John Deshawn. I'm a financial advisor with Solera Asset Managers and Insurance Agency. We're located in Roseville, California, and we're a local independent financial services office. I've completed the American Healthcare Insurance Professional certification, and I'm certified to offer both Medicare Advantage and Medicare Supplement plans. I'm licensed and contracted with 11 major carriers of Medicare plans in California and several other states. But first, for compliance purposes, I must inform you that this course is not affiliated with, nor is it endorsed by any government agency or the federal Medicare program. It's purely for educational purposes, and there will be no offer to buy anything or sell any products. Each situation is unique, and you should consult with a licensed agent before making any decisions. Although our other videos will go much more deeply into this topic and others, here's a very brief overview of Medicare in general. Well, there are two parts to original Medicare. Medicare Parts A and Part B. Part A is your hospital coverage. You pay no monthly premium for the coverage if you or your spouse have been working and paying taxes for 10 years. If not, you may pay a monthly premium for the coverage. You may be automatically, or actually you will be automatically enrolled in Part A when you turn 65 if you qualify. Part B is your doctor or medical coverage as an outpatient. You will pay a monthly premium for Part B, which will change each year. In 2021, it's $148.50 per month. Each year it goes up, a little bit of a cost of living increase. This is where the question starts happening. Well, do I need to sign up for Part B if I have coverage through my employer? Well, let's start with when you are first eligible to enroll in Medicare. Most people enroll in Medicare during their initial enrollment period, or IEP. Your IEP is 7 months long. It includes your 65th birthday month, plus the 3 months before and the 3 months later. When you turn 65, you're automatically enrolled in Part A. And if you're already collecting Social Security benefits, you will be automatically enrolled in Part B as well. If not, you need to sign up for Part B also online or at your local Social Security office. You may refuse or delay Part B enrollment and just take Part A. This may be a good idea if you have health insurance through an employer or your spouse's employer. If you do have employer coverage, some employers require you to take full Medicare benefits, Part A and B, at age 65. If your employer has 20 or fewer employees, you are required to enroll in Medicare when you turn 65. Otherwise, with larger employers, you may choose to defer enrollment in Part B until you retire and lose that employer's healthcare coverage. But is that always the best thing for you to do? To wait? Well, we're going to talk about that in a moment. But first, let's look at the special enrollment period for those who work past age 65. Now, there is a special enrollment period for people who work and have employer coverage past age 65. You have 8 months to enroll in Part B and Part A if you haven't already. You will enroll in a Medicare Advantage or a prescription drug plan within the first 2 months. You may. It's important to pay attention to this timing. As we've mentioned, both Part B and Part D charge late enrollment penalties. Well, one more thing. Make sure your employer provides you with proof of what's called creditable drug coverage. This means it's at least as good as Part D provides. You can get this from your human resources department. If your drug coverage isn't creditable, you will face a fine of additional 1% of the average Part D plan premium for each month that you delay enrollment in a Plan D, Part D. The penalty is charged every single month for as long as you're enrolled in Part D. Medicare supplement open enrollment period is 6 months long and begins once you are enrolled in Part B. Well, having health insurance through an employer after turning 65 may not always be the best option. Most people never give any thought to considering their healthcare choices. It's important to explore all of your options. So how do you decide which option is best for you? Well, before we get into cost and coverage details, ask yourself 2 questions. First, do you have dependents on your group coverage? If you do have a spouse on your plan that is not yet 65, that could make an employer plan a better option. Your spouse will more likely lose the employer coverage as soon as you disenroll from it, and their coverage through the individual marketplace could be significantly more pricey. Well, your spouse will more likely choose or lose the employer coverage as soon as you disenroll, and their coverage through the individual marketplace could be significantly more expensive. Secondly, if you're taking any high-cost name brand medications, your employer's plan will probably provide a more comprehensive prescription drug plan. So if you have no dependents or any high-cost medications, Medicare may be a better choice. Before you drop your employer's plan, however, and enroll in Medicare, you should talk to your company's human resources department, and secondly, speak to a Medicare insurance broker like myself. It's important to pay attention to enrollment dates and to enroll on time. Otherwise, you could incur significant penalties when you finally do enroll and pay them for the rest of your life. Let's take a closer look at those penalties. Part A, Part B, and Part D may charge late enrollment penalties. The Part A penalty really doesn't apply to many people since most of us get Part A at no cost because we've been paying into it every paycheck for all of our working years. It's been seen as FICA on your payroll checks. The penalties for Part B and Part D could apply to more people, so let's talk about that. The Part B penalty is an additional 10% of the premium for each full 12-month period you could have had Part B, but you didn't, unless you qualify for a special enrollment period or SEP. You pay the penalty for as long as you have Part B. Now, the Part D penalty is an additional 1% of the current average plan premium for each month that you're late. You pay the penalty for as long as you have Part D. So hopefully you enroll on time with no late penalties. Now, you do have options to change your coverage choices if you decide to. During Medicare's annual enrollment, which is October 15th through December 7th of every year, the new coverage goes into effect on January 1st of every year. During this time, you may join or switch or drop a Medicare Advantage plan or a prescription drug plan. If you drop a Medicare Advantage plan, your coverage will go back to original Medicare. If you're enrolled in a Medicare Advantage plan from January 1st through March 31st, then you can change your coverage, but just one time, to either a different Medicare Advantage plan or go back to original Medicare. If you return to original Medicare, you may also enroll in a Part D drug plan until March 31st. You may enroll in a Medicare supplement plan as well if you choose to. Now, lastly, if you have a qualifying life event, such as moving, you have 2 months after the month of the event to make plan changes in most cases. The main message to you here is that Medicare does provide opportunities so that you can change your coverage and keep it up to date with your life and your health needs. There is help with Medicare costs. If you need it, and if you qualify, you may be able to get help paying some of your healthcare costs. There are several programs that are shown here. It's worth asking about them, even if you think you won't qualify. A good place to start is with your state health insurance assistance program, known as SHIP, S-H-I-P office. It's highlighted here in yellow, or you could also call the phone number 800-MEDICARE. Well, thanks for watching this brief video on working past age 65. I hope you found it informative. You can check out our other videos to get more detailed information on the other parts of Medicare. If you have questions or you'd like to schedule a virtual appointment with us, here's my contact information. We're an independent insurance broker and specialist in Medicare. Don't have any obligation to any particular provider, but our commitment is really to doing the right thing for you each day, each year. Our service is to help you 100% free of charge. There'll never be any cost for our consultation. We've helped many people just like you through this difficult decision-making process, and we'd love to help you. Thanks for watching, and we'll see you in the next video.